Okay, we're going to show you the demonstration. This is Lab A, bisecting technique. We're going to show you how to operate the chair, the tube head, and how to turn on the unit. So to bring the chair up, there's buttons on both sides of the chair. The second to the first button, you're going to bring it up. This is the arm of the tube head, and this is your tube head. Then you're going to turn on the unit. It's the green button underneath the machine. We're going to bring the arm of the tube head behind the patient. And on the tube head here, you're going to see a black dot. That dot's always up, facing up, when you're aligning your tube head. You're going to bring the chair up at a comfortable position. So there's buttons on the side of the chair on both sides. You're going to bring the chair up with the second button. You're going to bring it up to a comfortable position. Not too high, not too low, about your chest area. Then you're going to position the patient. You want the occlusal plane to be parallel to the floor. So behind the dexter, there's the headrest. There's a latch underneath. You're going to open it. You're going to bring the headrest where the occlusal plane is parallel to the floor. And then you're going to lock it in place. So your occlusal plane should be parallel to the floor. We're going to start with number 1 plate. This is a number 1 plate, and this is your barrier. There's 2 sides to the plate. The blue side is the sensitive side. It has an A on the edge, and this is your indicator. When we place the plate in the patient's mouth, the A is always supposed to be on the incisal edge. So you're going to protect the barrier. You're going to protect the plate with the barrier, protecting the blue side with the black side. The A is going to be where the adhesive is. So you're going to place it in the barrier, making sure the A is where the adhesive is. The blue side towards the black side. Push it all the way in. Take the yellow tab off and seal it. So your plate should look like this. So we're going to use a stay block for the anteriors. We're going to break the edge off, and we're going to mark it in the center, and this is going to be your guide. So it should look like this here. We're going to place the plate. The A is going to be down in the slot. This is the slot right here. The A is going to go down in the slot, the black side towards your marker. You're going to push it all the way into the edge, making sure that the plate is in the center of your bite block. So it should look like this. We're going to put a piece of tape to keep the plate together with the stay block. So this is your number 1 plate. The orientation of the plate is vertical. The A is down in the slot. The plate is in the center of your marker. Okay, I'm going to show you how to place the first view. So we have dexter here. There's 2 prongs on the top of the dexter. To open the dexter, you're going to bring both of the prongs forward and release. To close it, you're going to bring both of the prongs to the back, release the one in the front, and push the second one to the back. Okay, so we're going to do the first view is going to be the central incisors. So we're going to place our bite block in the interproximal of number 8 and number 9. So we're going to use our blue marker, because this is the center of our plate, to put it in the center of 8 and 9. So we're going to bring the bite block into the center of the mouth, as close to the teeth as possible. bringing the bite block up against the anterior teeth on the incisal edge. I'm going to close the dexter gently, making sure that the plate does not bend on the palate, on the top. Okay, so now we're going to do the bisecting angle technique. We're going to look for the long axis of the teeth. We're going to look for the orientation of the plate. And then we're going to cut that angle in half, and that's going to be our bisecting angle. So the first point is the orientation of the plate. Second point is the long axis of the anteriors, the centrals. So that forms a triangle. We're going to cut that triangle in half, and that's going to be our bisecting angle. So the pink is our bisecting angle. So we're going to parallel our tube head to the bisecting angle, which is the pink line. This is our vertical angulation. So we're going to parallel our tube head, our collimator, to our vertical angle, which is the bisecting angle, the pink one. And this is your horizontal angulation. So your horizontal angulation is going to be, you're going to place the bite stick against the occlusal, against the buccal surface of the centrals, parallel to your collimator. This is your horizontal angulation. This is your central ray. So we're going to go behind the machine, and we're going to make sure that the central ray is in the center of your plate. So your central ray has to be in the center of your plate here. Then we're going to check for the bottom of the collimator to cover where the bottom of the plate is. So we're going to place our bite stick against our collimator, and as you can see, it's too low. So we have to bring our machine up to make sure it's going to cover the plate. And double check that the collimator will cover the bottom of the plate here. Your central ray is going to be in the center of your plate. So you can pull it out. Doesn't have to be too close to the face. And we have our first view position. Now we're ready to expose it. So we're going to go outside of the room, and on the window we have an exposure chart. So we're doing maxillary anterior. So the exposure time is 0.20. So we're going to go to our control panel. You're going to move it up or down depending on what view you're doing. So we're doing the maxillary anterior. Exposure is 0.20. So we're going to move it up. We're going to close the door, and this is our exposure button. So you're going to press it and hold it down. Do not let it go until the cycle finishes. We've exposed our first view. You're going to come inside the room. You're going to take it out of patient's mouth. You're going to take it out of the stay block. You're going to drop it in the cup with the barrier. Do not take the barrier off. Just drop it in the cup. Okay, so you just finished the centrals, and now we're going to do the lateral. So remember, if your student partner, move the chair up or down, bring it, position it back, bring it down, not too high, not too low. And I'm going to show you the lateral, which is number 7. This one right here, your placement. Just remember, orientation of the plate is vertical. Ace down in the slot. We're going to open the dexter. We're going to center the plate on the lateral. Bring the plate as close to the teeth as possible. Close the dexter gently, making sure the plate's not bending on the palate. Double check that it's not bending on the palate. Now we're going to do the bisecting technique. So remember, for the bisecting technique, you're doing the orientation of the plate, long axis of the tooth, you're going to cut it, and the half of that angle is going to be your bisecting angle. So the bisecting angle, once you find the bisecting angle, parallel bisecting angle to your collimator, and this is your vertical angle. Then double check your horizontal angulation, buccal surface of the lateral, parallel to your collimator. This is your horizontal angle, make sure those two are parallel. And then your central ray in the center, it's going to go in the center of your plate. So you're going to double check that by making sure that you're looking at the bottom of the collimator to make sure that you cover the bottom of the plate. So remember those 3 points. Right? So that's the placement for your lateral. Then you're going to do the third view on the maxillary is going to be your canine. So you're going to place it on number 6. This is your canine. That's your other view. So you're going to place the plate in the center of the canine and close it gently, double checking that the plate does not bend on the palate. So for the maxillary, you're doing 3 views. You're doing the central, that's one view. You're doing the lateral, and you're doing the canine. Now I'm going to show you how to do the lowers. On the bottom, you're going to do incisors and canine. So you're going to change your plate. For each view, you're going to change your plate. You should have 5 plates. So you're going to do 5 exposures. So every time you place a view, you're going to change your plate. So you should have 2 plates left over for your lowers. So we're going to do, I'm going to show you the lower incisors. So you're going to do the same thing. Remember, the A is in the slot, black side towards the marker. So now we're going to place the stay block backwards. So your triangle is going to be upside down. So we're going to move the tongue out of the way. And we're going to place it between number 24 and 25. The interproximal of 24 and 25, bring the plate as close to the teeth as possible. So we're looking for the centrals right here. So this is your premolars here, your canine, lateral, incisors are right here. So make sure it's in the center of both. And then close the dextra gently. Now we're going to find the bisecting angle. So we're looking for the orientation of the plate, long axis of the tooth, so your triangle is upside down. We're going to cut it in half, and that's going to be your bisecting angle. We're going to parallel the bisecting angle to the x-ray head. So now the triangle is upside down. So I'm going to show you that. Right? So long axis, so orientation of the plate, the long axis of the incisors. So that forms a triangle right here. Then you're going to cut that triangle in half, and that half is your bisecting angle. So my pink stick is my bisecting angle. So we're going to parallel the tube head to the bisecting angle, and this is our vertical angulation. So we're going to parallel the bisecting angle to the collimator, and this is our vertical angle. Make sure it's parallel. Then we're going to do our horizontal angulation. We're going to place it against the buccal surface of the incisors to the collimator, and this is your horizontal angulation. Make sure those two are parallel. Then the central ray, we're going to place it in the middle of the plate. And then we're going to confirm by double checking that it's going to cover the top of the plate now, because we can see the top of the plate. So we're going to look at the top of the collimator, make sure it clears. So just by looking at it like that, it's too high. So I have to bring it down. And make sure the top of the collimator is going to cover the plate. And we're ready to expose it. So this is a placement for the incisors. Now I'm going to show you the placement for the canine. So you're gonna take it out, change your plate, so you should have one plate left over. So we're gonna center it on the canine. Remember, move the tongue out of the way so you have enough room. Then you're gonna place your bite block on the center of your canine, as close to the teeth as possible, closing the dexter, making sure that the plate does not bend. And this is your placement for the canine. After you have completed your lab assignment, you should have 5 phosphor plates in the cup. We're going to take them out of the barrier and we're going to scan them. You're going to place them in your transport box with the blue side down. So you should have 5 plates. You're going to tear open the barrier. There's 2 little notches here. Just pull it apart. The blue side is going to face down on the box. So open your plates. Place them all facing down, the blue side down. You can put them on top of each other as long as the blue side is not up. So open your 5 plates, place them in the transfer box, close the box completely. You're ready to scan. I'm going to go into the scanning room. So you're going to log into Axiom. You're going to go to Rolodex, and you're going to type in your virtual patient, select it, click once, make sure you see it on the bottom of the screen here. You're going to select X-ray icon, click one time only. We're going to wait till the blue circle disappears. So do not click the mouse because you will freeze the computer. Just be patient. So once the blue circle disappears, we're going to select a template for that FMS. So you're going to drop down the box and select FMS 20. And you're going to capture a new series. You're going to select one of the empty boxes here. And then you're going to activate the scanner. So this is the machine that you have to click on this icon. Once you click here, this is our scanner over here. Once you click here, these lights are going to illuminate green. So that means that the scanner is ready and you can open your transfer box and you're going to scan the plates. So we're using the number 1 guides here because you have number 1 plates. So we're going to place the plates. We're going to scan the plates into the scanner with a sensitive side towards the scanner in a vertical position. You're going to put it into the slot and push it down. So once you push it down, the light's going to turn orange. Do not scan a plate until you have the green light again. So once the plate has been scanned, it's going to come out on the bottom. Once it's dropped on the tray, the plate is ready to be picked up and you can reuse the plate. Put a new barrier and reuse the plate to continue your assignment. So you have to wait till all your plates are scanned and they're going to come up on the screen here. So once all your plates are scanned and the red light has cleared, you're going to close My Packs and you're going to log out completely. Pick up your plates, put them in the transfer box, close your box, and exit the scanning room.